Welcome to this training. It's a cultural content. I can't remember how to say the word. So basically, we're going to have a conversation on how queer people can feel more comfortable in visiting doctor's offices, but not just as clients, but also if they want to apply, if they want to work there, if they need to know how to, what words to use to make people more comfortable, to open up. So sorry, I'm really nervous because I'm like awkward naturally. So again, I'm Cobella. I use she, her, hers. I would normally start us off with like an icebreaker because this is a small group. So we could do names and pronouns of people in the room. How do people feel about that? Okay, awesome. Do you mind starting us off?
Absolutely. My name is Tobechuku Udeibo, she, her, hers.
I'm Kaylee Thibodeau, and my pronouns are she, her, hers.
Thank you.
Hey, I'm Coral Cruz, she, her, hers.
Thank you.
I'm Tarani, she, her, hers. I'm Sarah, she, her, hers. I'm Zoe, she, her, hers.
I'm Rochelle, she, her, hers.
I'm Dalton, he, him, his.
I'm Sarah, she, her, hers.
H2.
Yeah. So thank you for joining me in this situation that we're at. So thank y'all for coming to the summit, first and foremost. Thank y'all for the work that y'all do. It's amazing. I won't pretend to be in y'all field because I'm not. I work with Breakout, which is so about Breakout. So Breakout is I call it an LGBTQ like political education program, built organization. But on paper, we want to end the criminalization of LGBTQ Black and Brown young people, specifically in New Orleans. We want to stop the things that make people just feel like these people are criminals, lock them away. So we want to inspire them to do trainings, inspire them to do political education courses, put them in contact with GSA, which is the Gender and Sexuality Awareness Network. So I do the GSA work, which is where I go into schools, create safe spaces, brave spaces for young people to have conversations with other, queer identified young people. It also inspires incredible leaders. I was a GSA president. I'm quite sure most of us know someone who participated in a GSA club. If you were able to be a GSA president, then you put that on your transcript. You can go to college and do GSA work in college. So boom. So basically we build on the rich and cultural traditions of resilience in the South. Rather it's making people realize that you're so resilient. And oftentimes people in New Orleans don't even realize they've overcome so many things. They're naturally resilient. So, does anyone have any questions about what is Breakout? Awesome. Y'all are a fabulous group. Okay, so the goals of this training is to basically increase the knowledge and increase the usage of words that make people feel affirmed when they visit the doctor's office. We also want to change negative behaviors towards people who identify as LGBTQ. Yes. We also want to promote more positive attitudes towards sexual orientation, gender identity, and expression. When those things are looked at as positive, people express themselves more, and people are more likely to talk to you and feel like they can ask you questions and be themselves. We also want to increase the knowledge of policies, if something's happening, how to put you in contact with people who know how to create policies, who know legislative stuff. Sometimes people don't know that there are groups here in New Orleans that when something's happening at the Capitol, they get people to and from the Capitol if they want to participate. So, that's any questions? I'm going to ask y'all if you have questions because I'm nervous. Okay, so why this training? Why are we here? So we talk about barriers a lot, whether it's language barriers, cultural barriers, or some barriers that I might not know about because I'm at privilege of not having that barrier. But the barriers queer and transgender people face when seeking access to quality health care, both personal and structural. So, like, how's a person feeling? And also, how does an institution make a person feel systematically? Personal barriers stem from beliefs, attitudes, and behaviors of providers and patients within the healthcare system. So basically, like what internal conflict someone might have that stops them from asking a nurse a question or stops them from asking their specific doctor a question. Any questions? Thank y'all for taking this training. Oh, we moving too fast. So here is the genderbread person. Is anyone familiar with the genderbread person? Awesome. So we more so use the genderbread person or the gender unicorn to kind of express to either young people or newly identified queer people. They can map themselves, they can see how they can create an easier way to tell people who might not identify as queer or might be like very vanilla and don't know any of these words. It's a way of really knowing how to tell someone, hey, I am a black binary trans woman and I move this way. And it also is a template that like directly shows when you're working with young people, like when we're at schools, we can't like just be very vulgar because that's not okay. But this is a way that you can see that expression is not directly tied to orientation, or it's not directly tied to sex, or it's not directly tied to identity. So it's a larger concept when you're able to look at it from like bird's eye view. So has anyone ever used the genderbread person or gender unicorn before? Oh, okay. We got a mixed bag up in here, mixed bag of marbles. So my first time doing this, I was completely like, that's childish. I'm not doing it. I'm above it. And then I went to a conference and someone was asking me like, how do you identify? And then like I completely read off of this paper and we had a great conversation. So this can also be found on Google if you need to find this. I didn't create this genderbread person. Just throwing that out there. Okay, so now we can have like a small discussion before we get into the next slide. What's the big deal? Like, what's the point? Why are we here? Why do we want to be competent? Why do we want to understand the people that some of us are working for? Anyone have any like?
I think it's good to expand your knowledge because even if you are a part of a community or you've been working with a community for so long, it's things that you are not aware of, and so you may be offending the person that you're working with or a client you're working with because you didn't understand a part of their identity, and we know that things are always evolving, so I think being here just keeps you abreast and keeps you knowledgeable about ever-changing things.
That was beautiful. Anybody else want to add to that? Awesome. So if it's not a big deal to you, then if it's a big deal to somebody else, then you should definitely want to affirm them and want to make them more comfortable. I believe if something doesn't hurt me and it makes another person more comfortable, then I should do it by all means because I'm comfortable already. So I guess that's like a stake in like privilege or XYZ. I don't know. Okay. I don't know if y'all can see this. Do y'all want me to read it out? Like y'all like my voice or is it?
Yeah.
Oh my God, thank you. Okay. So healthcare providers' discomfort when treating transgender individuals may alienate patients and result in lower quality or inappropriate care as well as deter them from seeking future like medical care. So basically this slide is an academic way of saying like if you make people uncomfortable, they're not coming back to your doctor's office, which could result in them being like sick or XYZ and not feeling comfortable enough to come in and get the help that they need. And when we're talking about like STIs or XYZ, I feel like if a place is in a city and it's claiming that they want to help people and they're making people uncomfortable and people aren't coming there, they should take some accountability for like if the numbers go up or if more people become infected with a certain thing. Like it's about accountability. So that's a big word that a lot of people use and not really sure what it means. So there aren't many course offerings on LGBTQ issues in medical schools across the country. So how many of us has went to like, I don't know, what is it called, doctor school, and they gave you a course for 6 weeks on how to treat transgender patients? I doubt that that's a thing because up until like 4 years ago, we wasn't even recognized as like people. So that's a thing. Um, Unfortunately, many institutions, um, I don't know that word. Consciously or not, have made it very difficult for transgender people to receive respectful, acknowledgeable treatment. So basically, like, yeah. Any questions? I feel like this is pretty. This is pretty like black and white. Well, orange and yellow. And also, we've had like when we've done partnerships with like Crescent Care or other care places. I don't know. I don't want to point anybody out. If we have, let's say, Breakout is having an event where we want people to get vaccinated, and then we're telling people to come to XYZ, and they feel uncomfortable, we feel responsible for telling those people to go get care, and then them becoming harmed or feeling less than when they're leaving the space. Have y'all ever had to like deal with that while working with people? Like just feeling responsible for it if you tell someone to go to a certain place and they are harassed or they are treated wrong. I feel like as a platform, it's our job to be like, this place is a shitty place and we're going to hold you accountable because most young people aren't going to use their voice to like write legislator to get a place closed down because they're being rude to them. Right. So this is a health survey from like 2010. So this is a long time ago, child. Stuff is totally different, but I think conversations are still the same, whether we want to believe them or not. We often think we live in a great time. We live in a place where people aren't being oppressed. We live in a time where people aren't feeling affirmed by the places that they actually pay to keep open. Um, So a large survey was conducted, and 70% of transgender respondents reported having one or more of the following experiences. So, does anyone want to read the experiences?
I'll read the top one.
Oh, thank you.
Healthcare providers refuse to touch them or using excessive precautions.
Mm-hmm. So, like I've heard earlier, like just how someone felt more comfortable because their doctor took the time to like walk them through certain things rather than making them feel like a person that's less than because of a diagnosis or because of a situation that all people can be prone to going through. Does anyone want to read the next one? Yes.
Healthcare providers, healthcare providers using harsh or abusive language.
Right. So, and that's subjective. I don't know what are harsh words. I don't know what are abusive words. But if someone is going a place and their dead name is being used or their pronouns aren't being used or their preferred name is not being used, that is harassment. Like that is harmful to a person, especially if they're coming to get help. Like what if they're going through something, they need treatment, you tell them that, they leave, and now they haven't been to the doctor in 4 years because you couldn't, I don't know, keep it cute. Does anyone want to read the next one?
Yeah. Healthcare providers being physically rough or abusive.
It's never okay for anybody to touch anybody roughly or abusively. That is not, I don't know if that's a word, but that's a thing. And if 70% of people are saying this, that's more than 50%. So I think that should be also highlighted. And the last one I'll read, healthcare providers blaming them for their health status. So, like, if I'm coming to get treated for something, Miss Mama, I don't care how you feel that I should have been doing XYZ. I'm not you. You're not my friend. I don't know you. Keep it cute, or you might get popped. I don't know.
I just experienced that.
Oh, you wanna share?
Well, just someone saying, uh, at a time where I needed not only closure or just making sure that everything I was dealing with was properly treated, and one of the responses of the nurse was, "Well, you know what you need to do differently now," and in that statement, the guilt that one would feel was very real, and then the side of that just has gone through all of these trainings and all of these sensitivity trainings. It just really popped in like, that wasn't right. I shouldn't be feeling this guilt for any reason.
I'm sorry that happened to you. And we're all adults here. You know what I'm saying? Like, Breakout works with people that are like 13 through 30. So that means, like, a 13-year-old was told you should know better when there's not even like sexual education classes that can help them, you know? So if that hurts you as a grown ass person, imagine being a person who's still finding themselves, who's like every interaction, like you're impressionable. Like every interaction, suppose that would have happened to a person that's 13 and then for the rest of their lives, they were like, I'm not going to the doctor. You know, that could create a spiral in a community that I think that doctor's office should be held responsible for.
And in my opinion, I feel like I'm actively keeping my health in check by doing this, and also at the same time being reprimanded.
And you paid for that visit, whether you got insurance or not. It's not no walk in the mall where some random person can tell you XYZ. You paid to go get yourself, healed, and a person who was in power felt the need to shoot you down, and that could lead to something horrible or horrendous. And it's not necessary. Ma'am, I came here for pills. It's not that deep. So even when queer or transgender people do receive medical treatment, their interactions with hospital staff, including physicians, nurses, allied health professionals, admitting and registration personnel, and security officers often result in negative experiences. So even if your doctor was really great and your nurse made you feel really welcoming, if you walk out of that and let's say a janitor looks at you like, oh, she's coming out of the HIV wing, like out of HIV wing, that can create a spiral of very horrible, horrendous things. And it's just not necessary. It's not needed. It's rude, and it starts conversation that won't lead anywhere. And yeah, I would ask if any of us have any testimonies to this, but I don't want to trigger anybody. Trigger warning, my bad. Examples of inappropriate staff behavior cited by queer and transgender patients include, can y'all see that, or do y'all want me to read it?
I can squint at
Y'all ain't got to squint. I can read it because I can see it.
it.
Okay. So examples of inappropriate staff behavior would be laughter, pointing, joking, taunting, mockery, slurs, and negative comments. So watch your eyebrows, watch your face, watch your neck. You know what I'm saying? Like, it's not necessary for someone to say, oh, I wasn't feeling well, and then the nurse, like, what? You're not feeling well? Like, that's not necessary. I'm at a doctor's office, ma'am. I wouldn't come here if I was feeling top of the morning. And also, I should be coming here if something happens to me. Violations of confidentiality, regardless of HIPAA. So basically, like, the messy nurses don't need to be watching who comes in the door, keeping tabs, They don't need to be, we're here in New Orleans, they don't need to be here at the DJ stopping people and being like, hey, you came in last week. How you feeling? Or they don't need to be like getting on the Keith Carroll show on Instagram and being like, I saw Kimora come into the doctor's office, and we know what happens in that doctor's office. It's unnecessary, it's rude, and it shows that you're unprofessional, and I think you should be fired. My opinion. Use of improper name and or pronouns for patients. So I don't care if you have their whole social security number. I don't care if you have their whole government name, their whole dead name. It's completely unnecessary. If a person tells you, my name is Elizabeth, I don't need you to look at my file and then be like, your name is Claire. No. You need to stick to the preferred name that I gave you, because using someone's dead name is a form of harassment. It's rude. And oftentimes, it's dismissive. Most people have went through a lot to get their names changed. Even if they haven't, they've done a lot of work to be called to be respected. And it's just rude for a person I'm going to have an interaction with for 5 minutes to make me feel a way about a name that I'm going to have for the rest of my life. Exceptionally long waits for care. Does anyone? I don't understand how that could happen. Does anyone want to enlighten me?
I saw a video on YouTube. I guess it dealt with a person who works as an ER nurse, and they were just giving an example of someone who possibly was either shot as opposed to being in a car accident.
Mm-hmm.
And the point was more so the people who were in the accident became a lot more understanding of the person that was shot because of the level of the trauma.
Mm-hmm.
But they also were talking about how we were in this ER for 4 hours waiting for 4 hours waiting for care, and then saw that other person come in.
Mm-hmm.
However, that might be a reason as to why someone has a long wait because of other situations that may arise, whereas the based upon their training in that triage to take the more life-threatening situations ahead of them. But then again, I don't work in hospitals.
Me either. I don't work at the hospital. But I know that if my arm is hurting and I go to the emergency room and I want my arm fixed, I don't give a fuck. I'm sorry. I don't care about the person who's on fire. I don't care about the person who's having a baby. I came in here because my arm is hurting. I have number 3, so I should be seen third, And I think this also goes to people thinking that people who have been through excessive amounts of trauma or who have been through who have this perceived hard life can sit and wait while someone who is quote unquote frail or XYZ.
I think sometimes also it has to do with hospital systems or doctors' offices not employing people who are comfortable with or want to educate themselves with certain populations, right? So people will wait because doctors will be like, well, I don't know how to do HIV care. So there's one doctor in the whole hospital that knows how to do that, but it's not that complicated. If you're a doctor, you could figure it out. It doesn't take that much extra training. And I think hospitals should be more cognizant of if we're going to be a hospital system, we need to have 5 doctors who are comfortable with this. And so if we only have 1, y'all either better get trained or you better get gone because we're getting 5. And I think that's why people wait, because they just don't care about having doctors who are comfortable providing services to LGBTQ people.
Austria has 1 HIV doctor.
You know how long you have to wait to see that one person?
He only doesn't leave because he needs to be there, he said. Yeah.
But they could hire someone else. I just refuse to believe they couldn't hire someone else.
Right.
And communication. How hard is it to tell a person that's been waiting for 4 hours, hey, we only have this one specialist. They'll be in at 2 o'clock tomorrow. Do you want to come back? Don't have me waiting from 4 p.m. to 9 p.m. just to tell me I have to come back tomorrow at 2 o'clock because I've wasted my time. Okay, good God. So, inappropriate questions or exams, including needless viewing of genitals. Oh. Well, does that offend anybody how it offends me? I mean, if my arm is broke, I don't need you to examine my ball sack. That doesn't make sense. I don't see how those things go hand in hand. So not being allowed to use the bathroom at a doctor's office is rude. I don't know how else to clarify. I'm not about to hold my piss while I'm waiting to get my arm looked at. I think it's rude. I think it's unnecessary. And people be at the ER for hours. Mm-hmm. So you mean to tell me not only is my arm broke, but now I have to pee. I've been holding my bladder for 2 hours. I done peed on myself. This is embarrassing. I'm never coming back to this place. Inappropriate room assignments. Does anyone know what that means? I don't know how they can make a.
I was just thinking maybe in certain facilities where it might be like separated by gender, maybe like someone being put in a woman's dorm when they identify as a man, or vice versa.
Mm-hmm.
Or the moderator's example in the beginning of our summit, where she spoke of her childbirthing experience, and when she was placed at the very end of a hallway and used and treated with distance because everyone looked at her chart and expressed a certain sense of it seemed as if it was disgusting them or wanting their own protection.
Medical professionals. Idiots.
I love you.
So failure to follow standards of care. So if there's a rule book and there is a format of how I should be treated, if I'm able to go online and read it and know that I should be treated XYZ, I mean, I don't need you to bring me a Gatorade and crackers. But I also don't need to be sitting here for 5 hours being harassed by every person who walked by because my arm is broke. I'm sorry to keep using that. I broke my arm when I was younger. This next slide. Health risks associated with medical professionals having negative attitudes towards sexual orientation, gender identity, and expression. Specifically, effects of negative attitudes towards queer and transgender patients. So is that hitting anyone? Is anyone
I think for me, when I was working outpatient and I was trying to get a person who identified as transgendered inpatient for rehab treatment, that was the hardest thing to do. Because they didn't have, when you said inappropriate room assignments, they were so focused on where they were going to place the person that they weren't thinking about this person needed to be in treatment. It was so much care about, are we going to offend the other people if we place them in this dorm versus this dorm? So it's very hard sometimes trying to find adequate care.
There was somebody from a clinic that was posting on Facebook about, I saw a 12-year-old receiving gender care, all this stuff, and it was all public. Mm-hmm. It's just, get the receptionist,
So this instantly makes me think of, as a queer person, there are certain things that I don't do nor go. You know, if I want to go to church, I watch it on YouTube. If I want to, I don't think the doctor's office should be in my head as toxic as the Baptist church. Not trying to call anybody out, but it's a doctor's office. I don't need you to know my religion I practice. I don't need you to know who I'm sleeping with. I don't need you to know any of those things. And if any of those things become necessary for me to be there, then I won't be there. So that's a problem. And I feel like we're having a real problem in this country with people being passive aggressive about things. So this may show up in a way that's a lot more toxic than it even sounds, So I just wanted to point that out. That even though we obviously this is so wrong, this can show up in a passive aggressive way that a person might not even realize until they leave. Then they're triggered and they're hurt. And they're telling other queer people in their community not to go to this place because they mistreated me. And there's no law against being trans or queer, so Miss Mama, I can do what I want. So I just felt the need to clarify that. Effects of negative attitudes towards queer and transgender patients. Yeah, the effects of being treated horribly. Oh my God, who would have thought that there are effects to treating people like trash cans? The end result often has been disengagement from the healthcare system that results in poor health outcomes for queer and transgender people. So I've been saying this for the last 20 minutes. But yeah, no one's going to argue with the doctor's office to be at the doctor's office. They're just not going to come back. They're going to make a TikTok and talk about how it's so rude. And then more people's going to know that this clinic is messed up. And then more people is not going to come to the clinic. And guess what? These people probably all fucking each other. So stuff is getting around. Yeah. So rather than enduring abuse, poor treatment, queer and transgender people often simply do without health care. So not only is the kids not, we're not talking about Fortune 500 people. We're talking about everyday people who work at everyday jobs. We're talking about baristas. We're talking about nannies. We're talking about normal people. These is not millionaires. They're not billionaires. They're not going to go out of the state to get help. They're not going to do any of that. Like, they're just not going to go. Yeah, that hurts. As a result of disengagement, treatable medical conditions too often become emergency medical problems, a common situation in communities with less access to care. So, like we just pointed it out, like it's a cause and effect situation, and I think the person that causes this trauma should be held accountable, especially if it's done to young people or if it's done to people who like are suffering from mental health stuff and need to go to the doctor. Yeah, I just stuff be triggering. Ooh, most stuff. So 2011 was a really tricky year for Breakout. Breakout was started because, I don't know if most of y'all know this, but in 2011, it was a crime to carry more than one condom in known prostitution areas. So a lot of Black trans women now face, and thanks to people like Wendy, I don't know her last name, sorry, but the Cans Can't Stand situation, they have to work to get people's stuff expunged because of that, people are now on the like sex offender list for like being caught with more than one condom, and that being used to say that they were prostitutes. Anyways, 2011 is horrible. So in 2011, 19% of the respondents reported being refused health care due to their transgender or gender non-conforming status. That makes no sense. I think we've come very far now. They don't ask, or there's check marks for like if you're male, female, or I don't choose to disclose. But we also have to remember that there was a time where that was not a thing. In addition, 28% had postponed necessary health care when sick or injured, and 33% had delayed or had not sought preventative care because of experiences of healthcare discrimination based on their transgender status. A lot of my friends, we do know that PrEP does help with people to not become, I would say not become, but when you're on PrEP and you're exposed to HIV, you're less likely to get it. But in order to get on PrEP, you have to go to the doctor and you have to say all these things. And most of the time, if your doctor, I'm trans, if y'all didn't know, but if you go somewhere and I tell my doctor I want to get on PrEP, and he's like, but you're da-da-da-da-da, I have to now disclose all of these things that's unnecessary. Like, I want to get on PrEP, you're supposed to tell me XYZ, I tell you that I'm aware of those things, and we start treatment. I don't want to know about all these things that's unnecessary. Did I read the last one already? This is true.
Just a plug for teleprep in Louisiana, because we have teleprep and we have the prep chat bot, so you can literally like text and then show up for your blood work and get the prescription delivered to your door.
We should make that more accessible because Moshadi, I did not know about that.
As a community health worker, we try to say as much as possible about teleprep.
But people gotta come to y'all. Gotta come to y'all place for that to happen. In addition, nearly 27% of transgender survey respondents reported being outright denied health care because of their transgender status. So even people being like, oh, we don't do transgender stuff. Like, I didn't come here to get on hormones. I came here to get my blood checked for high blood pressure or something. I don't know. And every time a transgender person goes to the doctor, it's not always connected to their identity of being a trans person. And if I'm on hormones, even if I have a migraine and I go to the doctor, they shouldn't tell me, oh, you have a migraine because you're on hormones. Like, everything becomes connected to either your status, or it becomes connected to you being trans, or it becomes connected to you putting your body through puberty twice. I don't know. That's rude. Do we have any questions about these numbers? These numbers have not improved, by the way. They're pretty close. That's why I didn't change the stuff. Structural barriers operate regardless of individual attitudes. Does anyone know what the term like systematically oppressed means? Right? I'm seeing a lot of head shakes. Yes. That means that like the system is oppressing me. It doesn't matter about Karen and how she feels. The whole system makes me feel oppressed. I don't even care that this girl does not like me who works at the doctor's office. Because in my head, the whole industry does not like me. So that's kind of the difference between like structural barriers and personal barriers. I believe as people, we're going to have personal barriers. We're going to have language barriers. We're going to have belief barriers. We were all raised differently. We got different mamas, you know. I don't know what went on in your household, and it's not my business. However, an institution, a building, an organization should not have the right to make someone feel small and like have the people who work there feel empowered by it. Like if someone misgenders you at a doctor's office, they should know like if I get caught misgendering this person, I'm gonna get fired. I'm gonna get reprimanded. Nowadays, they just be like, oh well, it was a mistake. It was what it was. There's no consequences for them misgendering people. Okay. Limited insurance practices. So basically the practices at the insurance place is limited. Yeah, we're using code breakdown words. Failure of most healthcare insurance plans to cover the cost of mental health services. Cross-sex hormone therapy, gender affirmation surgery. All these things are things that most insurance places are like giving people hard times. Yeah, like in New York, when I was living in New York, like there's a large system of like insurance and XYZ. So people are getting checked more oftenly. People are getting cured more oftenly. Like we live in Louisiana where like a lot of people don't have insurance. So they're not about to pay $1,000 to get lab stuff done and have to pay that out of their pocket. This barrier exists despite evidence that such treatments are safe and effective, and that cross-gender behavior and gender identity issues are not an issue of choice for the individual and cannot be reversed with psychiatric treatment. Yeah, so if I'm going to get on hormones, I don't need a nurse coming telling me like, oh, I don't think that you should be trans because you're going to die in a lake of fire. Like, I don't need all of that. I don't need my insurance place telling me that I don't need my titties done. Listen, I have insurance. I'm doing the copay. I'm paying it. What is the problem? Does anyone have any feedback or
I just wanted to add into that, like, I think it's important, especially for employers, right? Especially like if you're working in like an HIV organization or like a queer organization, right? Like you need to make sure that the insurance that you're offering your employees is gender affirming and like offers those services, because it is staggering how much, organizations that are supposed to be like for LGBTQ people and staffed by those people, like the insurance doesn't cover gender affirming care, and it's like, what? Like, y'all want to complain about this all day, but then you're not paying for it? And if we stopped buying those insurance plans, they would have to change their policies. That's my soapbox, the end.
And I think most transgender people know, like, I started my transition when I was about 15, 16. And in order for me to get on hormones, I had to basically, well, with my mom and stuff, all of that. But the next step, I had to tell basically my provider and my doctor that I could not live like this anymore. Like, I had to transition. I had to do XYZ. If you make it seem like you can live your life without the help from them, they're not going to want to help you. And I'm down to have more conversations about that. But I basically have to tell them, like, if I don't transition, I can't live as a gay man. Like, if I don't transition, my dad's going to kill me. Like, it's going to get bad. Like, da-da-da. Like, I couldn't just be like, oh, I want to transition, so I'm transitioning. No, I had to have said reasons why I could not live as a queer person if I wanted help from them. And I know that's not everybody's experience, but that was my experience and a couple of the other girls who I was talking to who was buying hormones illegally experience. So, yes.
I just want to know a little bit more, like, how did that impact your mental health? And how can us as providers, like, help with that? Like, at stigma and all of that, like, that's a lot right there. 16-year-olds go through and have to come up with this story. Like you said, like, I'm not sure if that was truly your, like, story. If it is, I'm very sorry to hear this. Like, how can we support with that?
I think just eliminating it. I'm already in this office with my parent, who is my legal guardian. She's already okay with me starting this process. I don't have to pull her to the side and be like, I'm about to lie on dad real quick. Don't take anything I'm saying to heart. Like, I have to make my parents, who are very accepting and who love me, sound like the worst people on the planet. Like, and I do actually fear for my life. Like, as a trans person, like, if I don't get XYZ, then I can be clockable and I can be, like, hit with paint walking down the street if I want to wear booty shorts. That's a real thing. And I just think it's unnecessary. If my legal guardian says I can do this, if my insurance is going to pay for it, I don't think that I have to have this oppressive story of why I can't live my life. Like, just affirm my existence. Don't create more trauma and more hurt. Because now I have to leave this doctor's office with my parents, who, like, it's a very slim chance that that a young person's parents is going to let them get on hormones. And now I have to sit here and lie on this person and make it seem like this person is the scum of the earth because I'm getting on hormones. So, yeah, so I just think eliminating it, or, like, making it to where, do you have a parent, like, there's a checklist. You have a parent with you who's willing to do this. You're willing to do this. You're not being coerced. And I think they try to do that to stop people from transitioning too early and feeling I'm sorry. Transitioning too early and feeling like they've made a mistake, but that shouldn't be a provider or an insurance place's business. Like, the insurance company is going to profit off of my transition no matter what. So if I want to get my boobs done and then I want to get them undone, you're going to make money from the whole process. So why make me feel like shit? That's how I know. Any reactions to that?
It just seems like they do it to hide their hate. Like, if they can pretend like it's in the self-interest of the individual, then you get to hide behind well intentions with bigotry.
Yeah, it's like, I truly feel like I need facial feminization surgery to, like, feel safe in public and to have a happy life. But it's $30,000, and 99% of insurance companies don't cover that, and sometimes I get suicidal thoughts, and it's purely evil that that's not considered necessary care. And I really think the trans suicide rate would dramatically plummet if access to that and other gender-affirming surgeries were more accessible.
And they try to make it seem like we're just robbing the state. We just taking all these resources. Baby, I pay for this with my taxes on my hard-earned coins. The consequences of inadequate treatment are staggering. I ain't write that sentence, but that's heavy. Okay. 54% of transgender youth have attempted suicide. Child, took me fast. Trigger warning, y'all. Watch yourselves. 21% resort to self-mutilation. More than 50% of persons identified as transgender have used injected hormones that were obtained illegally or used outside of conventional medical settings. Like I told y'all, if every day I hear that I need to get on hormones, if I try for 2 months to get on hormones using my provider and using my insurance, and I can't, guess what? I'm going to find them. I'm not going to just stop being a trans person because I can't find them. It's going to give me a reason to start taking illegal drugs, start taking drugs that's not in my name, start taking stuff from people who I don't know what it is. And I think that the insurance companies and like our providers and doctors and people who make people feel uncomfortable or unaffirmed should be held accountable for that. Like if I'm a girl who just was looking for some spiralactone and this person give me fentanyl and now all of a sudden I got a fentanyl obsession, it's their fault. Because had I just got the spiralactone, none of this would have been necessary. And sorry if this is like a dark part of the conversation. Are there any like reactions to this that people want to share?
People who face medical repercussions from trying to physically transition outside of medical settings should also be able to be compensated. Like there should be, because they were forced into that situation.
And some things are irreversible.
Yeah.
So if I want to go to the doctor and I want to get my butt done, right? And the doctor don't want me to get my butt done, and they make it all hard, and I got to pay all this money, but the girl, Tamika, down the street is pumping girls. You think that I'm not going to get my butt done? I'm still going to get it done, but if I had another way of doing it, then I wouldn't do this, you know? Yeah. Sorry to use butt shots for that. I don't condone such things. Okay. Additionally, queer and gender nonconforming and trans youth are using self-administered silicone injections to spur masculine or feminine physical features. See Breakout pumping guide. I was supposed to bring y'all some pumping guides. But it's basically, it's a campaign that we did to stop people from getting pumped. And a large part of that campaign, we say, like, unless there are other alternative, like, unless there are other ways of doing this, people are going to do it. Like, we live in the era of aesthetics. We live in the era of a great picture. We live in the era of va-va-voom, you know? And if people can't get things done professionally, they're going to get things done. Like, people are very persistent. People are very resilient. And people are hard-headed, because my head is real hard. But how does this make people feel? Like, you know, don't sit with it too hard. But, like, if I could go to the doctor and get my butt done in a way that's safe for me, I would.
And just knowing people who've had medical complications, like 10 years down the road from pumping, it's like heartbreaking. That's totally preventable.
You want to know a secret, though? When you walking around with no butt, and you want some butt real bad,
I don't have a butt. I know.
you don't care. Like, right. And I hate to say it because it's taboo. You don't care.
Right.
Like, girl, it's gonna be more hard to walk around on Earth without a butt than it will be if it's lights out in Georgia, because I done did XYZ. Yeah.
I'm curious too, like, for cisgender people, like, are there barriers to things like butt lifts and boob jobs? Because I feel like I see cis women like getting them all the time, like it's no problem.
Well, I would say this is not. I'm trans and I'm in the community, so that's where these numbers come from. But just looking at where we're going now, everybody wants a BBL. Everybody wants a facial film. Everybody wants the great hairline. It's only known because as a trans person, it's automatically assumed that you're going to have these surgeries. Even when I was in New York, so many cis women are going to get the same surgeries as trans women. It's the same.
And are their doctors all just signing off on it? Like, why is it different? Because it's the same surgery, right?
It's the same surgery.
Possibly money.
Mm-hmm.
I just want to note that those procedures, as well as the facial feminization surgery I was talking about, are classified as cosmetic. And so, for cis people, it may or may not be gender affirming. For trans people, it'll always be.
Right.
And that's a slight, just thing to note.
Okay, so there's like a difference with the insurance. Like, it shouldn't be cosmetic because it's not.
Right.
Because it's medically
It's gender affirming and yeah.
So like if I wanted my boobs done right, so let's say I was a cis woman who wanted her boobs done. You want your boobs done, that's fine. As a trans person, you have medical history that you're not this person who you say you are. Like, it's just a lot of red tape that's not needed, Like, now I have to go through therapy, and I have to make sure that I'm making the right decision. I have to make sure that in 10 years I'm still going to want these titties. And I have to make sure that I'm not doing this because I have body dysmorphia and it's not displaced into something else, which is something cis people can have body dysmorphia.
I did not go through that for a boob job as a cis person.
And you wouldn't. I know you wouldn't. But yeah, surgery is gender neutral, okay? And I don't know if y'all looking at Instagram or nothing, but they got rappers with more surgeries than I got. So it really don't matter at this point. Best practices. We're on slide number 18 out of 30, so I'm a little nervous. I don't know how long I got with y'all, beautiful angels. So the best practices to make, to combat this would be a non-discrimination policy. So is that something that's on file? Is that something that is Googleable? Is that something that before I get there I can look up to make sure that when I'm here sitting in this office, Chantel doesn't misgender me and there's nothing I can do about it? Patient's Bill of Rights. So I feel like if you got patients, they should have rights. And they should be in a bill. So you should have a patient bill of rights. It makes sense. Registration. I think registrations can be used for good and bad. But on a registration form, have preferred name. Have XYZ. If you're going to have a registration, use it to affirm people and not to make people feel less than. Like, you don't have to have, what's your government name? What's your sex? I'm not saying that, but I'm saying if you're going to have a registration, have it to where people can write what they want to write. People can put that they don't feel like disclosing that, patient interaction policy. I'm not aware of what this means. If anyone wanted to give insight on an interaction policy, I'm gonna just use my my word code situation that I got. So basically, have a policy on how your staff should interact with their clients, and also have some type of consequences for when these are violated. Because there's no point of having these policies in these formats if nothing's going to happen. It's actually ruder. It's quite rude to have these things. And then, I go through all of this, and then nothing happens. Room assignments.
Hey, I was just thinking, I think in my clinic, part of the patient interaction policy is also making it clear how people can file a complaint.
Yeah.
And so I think just that also, like hearing, especially in the panel, thinking about all the people that were able to go back and say and advocate for themselves. I mean, part of that process would also be like people know how when they are offended, when they have suffered abuse, they should be able to also know how to. What's the process to say this is a problem?
I will say from personal experience and from several other community members, I know certain organizations like Ochsner do not respond to trans-related grievances.
Yeah, and that's what I mean. Like, it's great to have all of these policies and have all this protocol, but it's like it has to have teeth. It has to have reason. It's like I don't care if I sit here and I write this stuff down, I word it right, and I send it to my 3 friends to make sure I'm not being extra or dramatic, and nothing happens. Or I send that email and it's going to a place where no one ever checks it. It's going to a place where no one ever reaches out and said, "Hey, you emailed XYZ about ABC, and here's what we're going to do following these steps." Access to restrooms. Come on, people piss.
Same color.
I prefer gender neutral restrooms, but it's not 2050 yet, so that's not a normal thing. But yes, access to restrooms. I use public restrooms, but I never really use them. I like go in there and I stare at myself. But yeah, everybody should have access to a restroom. Especially when we're talking about people being in your office for, most people don't come to the doctor's office and stay for 10 minutes and leave. This is something that you gotta check in, that take 20 minutes, then you gotta wait, that take 20 minutes, then you gotta wait on the doctor while you're chilling with the nurse, that take 15 minutes. I've been here 4 hours. I need to pee. Like, I think we should also serve food at this point.
Like at our facility, it's not gender neutral because we are in a very old building. So we do have like keys where it's, gender specific. But what we do is that if someone asks to go to the restroom, we just point them to the keys so they pick up whatever key they feel comfortable. Because we don't want to just assume because of your appearance. So we just give them the option of they grab whatever key they need.
Yes. Give people options because they'll take them every time. HIPAA. Does anyone want to, I don't know what HIPAA is. Does anyone know what that is?
It protects your privacy. Like the medical privacy.
But what the acronym stand for?
It's health information.
Go ahead.
Oh, I'm not sure what the AA is. So
Health Information Portability and Accountability Act. So it's your health information. It's a federal law, and it's serious.
And can a bitch be fired for violating HIPAA laws?
Yes.
Yeah.
And get into license problems. Yes.
But it's still done all the time.
We just want to make sure these things have teeth, because normally it's like, yes. And how do we normalize it? How do we make it accessible? How do we have it to where even the little 13-year-old who's going in knows that if they violate me, I'm writing this down and it's going right to HIPAA and she's going to be fired tomorrow. Insurance guidelines. So what are the guidelines of my insurance? Like knowing them, knowing that my insurance covers XYZ, knowing that I have the right to all these things, because I've learned there's a lot of red tape when it comes to insurance, and you will talk yourself out of getting something free just because you didn't know that it was free, or no one told you that if you say XYZ specifically, then your insurance will cover it, Overall treatment. Now, number 9, you tried it. But best practices is all of these things right here. Any questions? Does anyone want to add to this? It's a living document. I ain't reading this. But this is a non-discrimination policy right here. Boom. So, we could take a couple minutes if y'all want to read it. But it does point out things like the Affordable Care Act. It points out stuff like the Patient Protection and Affordable Care Act of 2010. Basically, this is a non-discrimination policy. If y'all needed me to copy and paste and send it to y'all, first I need y'all emails, and I ain't got that, so we're gonna move on. Okay, so here's more stuff when it comes to the discrimination policy. I'm sorry, y'all. Y'all want me to read this? Cool. I like y'all. Y'all so smart. We're gonna leave it up for a couple of more minutes though. Do y'all want to talk about anything? Good. Okay. So 2, Patient Bill of Rights. So just as hospitals are obligated to respect patients regardless of race, ethnicity, age, religion, creed, sex, disability, and sexual orientation, so just like people are supposed to be like treated well and not like denied because of their race or because of their height or because of their waist size, you cannot violate somebody because of their sexual identity, sexual orientation. People have rights. And when people start pulling out the Bill of Rights on you, your organization or your practice is going down. Because that's not okay. Okay, registration. An important first step towards respecting transgender patients' dignity and creating a transgender inclusive environment is to address transgender patients by their preferred name and pronouns and to affirm their gender identity. Failure to identify a transgender patient by a patient's preferred name and pronoun in a medical setting has been shown to negatively affect satisfaction and quality of care for transgender patients. So, what basically, I don't care how great your office is. I don't care if it smells like cinnamon. I don't care if it has the greatest seats. I don't care if your doctor is really great. If I come in there and someone misgenders me, you have the worst place ever. It's horrible. It needs to be shut down. It needs to be torn down. Like, that's how people feel. So if you're going to invest in, I don't know, making sure all the lights are fluorescent, also invest in the fact of having a registration where people can tell you who they are, what they want to be called, and even on a registered list, like, show them their Bill of Rights. Like, show them the policy. Show them, like, while I'm sitting here for 5 hours, I read your patient Bill of Rights and you've been violating. So, it helps. Ooh, this is what I didn't know about. Okay, a patient interaction policy. Referring to transgender people by the wrong pronoun or name, or asking inappropriate questions about genitalia or surgical status in an effort to determine their true gender is a form of harassment. Okay? Does everyone know what harassment means? It's when you make an ass out of yourself for being rude to someone. But yes, does anyone have any reactions to this? I felt like it was very straightforward. Good. Transgender patients may be reluctant to share information regarding transgender status or transition-related services because they fear discrimination or inappropriate treatment, even when this information may be integral to the patient's care. So yes, that's why in a lot of surveys you don't see where it says, oh, these women said this man said this transgender said this, because they're not gonna say that, okay? I don't know. It's weird. We can have other conversations over coffee about why I lead with the fact that I'm a woman and not that I'm a transgender. Doesn't even make sense. It's not even a noun. Okay. So, room assignments. The failure to grant room assignments to transgender patients in accordance with their gender identity is a form of discrimination that jeopardizes transgender patients' dignity and privacy, and in turn discourages them from seeking medical services. Like we said earlier, if you make someone feel uncomfortable, they're going to leave or they're going to fight you. It's best that they leave. Yeah. Gender affirming room assignments are a crucial step towards breaking down barriers that have hindered transgender people's access to health care. I believe room assignments are very important. I don't think they're that important, but they are very important. And a room should affirm how a person feels, or you should not assign rooms. It should just be pick your poison. I don't know. Access to restrooms, like what is this? It's not like 2012. If the place you're working at does not have a binary bathroom and a non-binary bathroom, I don't know. How does people want to react to that? I don't use public restrooms like that, so I don't feel I have to directly impact it.
We had a whole
Standpoint
like
on this.
employee staff conversation about how we wanted to handle it at our office.
Mm-hmm.
They were working on the changes.
Mm-hmm.
I don't work in that office building, but I witnessed all of that.
Did it go well?
For the people who actively participated in it, I think it was more progress than we have. They did go with like a femme to neutral and then like a mask to neutral. So like people could pick. Okay, but it still is very binary in
Did y'all have
certain
any
ways.
like trans-identified people in the conversation? And
Yeah.
that's always important.
I believe, if I may, I believe the laboratory situation at the place where I'm located as a community health worker, I'm located at Crescent Care. Their situation is pretty, if I may say, neutral. Whereas each stall within, it's like a bathroom location. Each stall has its own private door that goes to the floor. No, there's no urinal available. However, the privacy is something that is second to none, and a row of areas sinks, as opposed to, let's say, like a building like we're in currently that has male female very very distinctive on that front.
And do you know why Crescent Care should be leading the pack in these restaurants?
What would you say?
Because everybody and their mama go to Crescent Care. So it shouldn't be a problem.
My life.
It shouldn't be a problem now. I didn't mean to say that like that.
No.
I'm saying the place where most of us go should be reflective of what we want to see.
My experience working there was not ideal for a lot of the reasons we're talking about today. I just wanted to say that.
And that's fine. We could have a matcha and talk about it.
I still get my care from there, but
Me too. They're the only ones in the city. That's fine. Okay, now we get into what I didn't know. HIPAA and other privacy-related statutes and their implementing regulations currently provide a framework for hospitals and providers to handle confidential patient information. However, hospitals, physicians, employees, and contractors may not be aware that a patient's transgender status or history of transition-related procedures may constitute protected health information under HIPAA's implementation regulation. So how do people feel reading that?
There should be a plain language summary at the top. Like if you didn't know that you have HIPAA rights when we started this conversation, you signed that form 1,000 times, I promise you. Every time you've been adopted. But you didn't know what it was, which is a failure of the system, not on you.
It's something. Consolidated on one sheet, all your intake forms.
Yeah, and it's law.
Nobody's
gonna do that.
You want to know what I got a problem with? In number 7, it say like provide a framework, right? So that means it ain't like really like a concrete thing, I'm guessing. I would say framework is like, never mind. We can get into that conversation later. This doesn't sound like something that's very concrete. That's all I'm saying. It sounds like wiggle room situation. Does anyone have any? Because y'all got to educate me, because I don't know.
HIPAA is very specific on some things,
Mm-hmm.
but there are places where it's not very specific or it's not super clear. And I definitely think the way that it's presented to like patients and clients is not clear. But there are definitely parts of HIPAA that are like very, very specific and descriptive.
And how do people find HIPAA?
You signed the form. You've signed it. It's just like a bunch of words on one page.
Yeah, you can definitely Google
How do you
it.
find?
Providers have to take trainings on it a lot. But yeah, I mean, I don't think there's very much like making it actual understandable for people that ever happens.
But is there like a HIPAA of Louisiana where if I was violated by a place, I could contact them to make sure?
It's to understand that the sharing of information for a patient in relation to that person and other parties involved, or other parties in any capacity. It's a privacy situation.
Yeah, so if you Google HIPAA, the first thing that comes up is the HIPAA website. It's a federal thing, and it's got filing a HIPAA complaint and my rights under HIPAA.
Well, like, you should know that as a community member who receives care. Like, it falls on us to make sure that you know what that means.
It's still very, like, a lot to read. I don't know if you can see how small this text is, but, like,
the fact that it's a lot to read.
And also it changes. Like, people that work in health information offices, they go to regular trainings because it changes. And there's all kinds of loopholes. A lawyer can tell you how serious HIPAA is. That's who you can talk to. Find out how serious.
So I got to retain a lawyer and use my 5,000 big bucks because somebody was playing with me. Okay, number 8, insurance guidelines. Everybody got different insurance. Everybody got different guidelines. Make sure you read your guidelines. I read everything. I even read my my Apple. I read that just in case. You got to read your terms and agreements. So, leading authorities in the medical and policy communities, including the American Medical Association and American Psychiatric Association, have recognized the medical necessity of sex reassignment surgery and hormone therapy for patients with gender dysphoria, formerly classified as gender identity disorder. Did that resonate with, like, does anybody need to know what an insurance guideline is? Okay, so normally this training is given to young people, so this would be the first time that they would be even looking at this. So we would normally go into deep on how you're supposed to read over these things and make sure that the insurance that you choose, because you do get to choose your insurance, the insurance that you choose is something that you're tailored to. So as a trans woman, I need to make sure that if I want services that are XYZ, the insurance that I'm choosing to get is going to allow me to get that. And my provider is going to accept it. You know, it's no point of paying $400 a month for insurance that you really can't use.